Hello friends, we are going to discuss about acid-base disorder, which is very important topic for NEET PG. So please go through the video till the end. Acid-base disorder. Acid-base disorder. First, high metabolic acidosis or elevated anion gap. So causes of high metabolic acidosis. First, K for diabetic ketoacidosis. Diabetic ketoacidosis. U. Uremia. Uremia in renal failure. Uremia in renal failure. Next, S is sepsis. S is sepsis. Another is starvation. Another is starvation. In starvation, we see diabetic ketoacidosis. We also see diabetic ketoacidosis. S. Salicylates poisoning. Salicylate poisoning. Salicylates poison. Next is next is methanol. Next is methanol. A is aldehyde poison. Aldehyde poisoning. L is lactic acidosis. Lactic acidosis. So what is the causes for high metabolic acidosis or elevated anion gap is Kussmaul. So trick is Kussmaul. So trick is Kussmaul. A term is Kussmaul breathing. So from that point we have got Kussmaul. Trick is Kussmaul. Next. Next is normal anion gap metabolic acidosis. Normal anion gap metabolic acidosis. EODP. EODP. Urinary tract diversion. Urinary tract diversion. Urinary tract diversion. R for renal tubular acidosis. Renal tubular acidosis. Renal tubular acidosis. Renal tubular acidosis. Very important point. D is diarrhea. D is diarrhea. P is parenteral nutrition. P is parenteral nutrition. P is parenteral nutrition. So normal anion gap metabolic acidosis, EODP, urinary tract diversion, R for renal tubular acidosis, D diarrhea, P parenteral nutrition. So trick is EODP. EODP. Next, to solve the problems are given from acid-base disorder, we should know the value. So normal value of bicarbonate HCO3 minus is 24. Is 24. If we see the range is 22 to 26. Bicarbonate is most effective extracellular buffer system at physiological pH. So bicarbonate is most effective extracellular buffer system at physiological pH. Next value is pH. pH normal value of pH is 7.4. Normal value of pH is 7.4. If we want to see the range, 7.36 to 7.46. Next, PCO2. So normal range of PCO2 is 40 and range is 35 to 45. Range is 35 to 45. And normal value of H plus is 36 to 44 milliequilibrium per liter. In case of pH, if pH is less than 7.2, it means severe acidosis. It means severe acidosis. pH less than 7.2, it means severe acidosis. pH greater than 7.6 means severe alkalosis. Severe alkalosis. What do you mean by anion gap? What do you mean by anion gap? Anion gap means sodium plus minus chloride plus HCO3. It is anion gap. So sodium plus minus chloride plus HCO3 minus. It is anion gap. What is the normal value of anion gap? Normal value of anion gap is 10. So normal value of bicarbonate is 24. Normal value of pH is 7.4. Normal value of PCO2 is 40. Normal value of H plus is 36 to 44. In case of pH, if it is greater than 7.6, so it is severe alkalosis. If it is less than 7.2, it is severe acidosis. Anion gap normal value is 10. Next is PCO2. PCO2. PCO2 increase and pH is decreased. So it is respiratory acidosis. It is respiratory acidosis. It is respiratory acidosis. So if pH increase means it is fully compensated. It is fully compensated. But in case of only bicarbonate is increased, so it is partially compensated. So it is partially compensated. But bicarbonate is normal, so it is uncompensated. So it is uncompensated. So if PCO2 is increased and pH is decreased, it is respiratory acidosis. To compensate, if pH is increased, so it is fully compensated. If bicarbonate is increased, not pH is increased, so it is partially compensated. If bicarbonate is normal, it is uncompensated. It is uncompensated. Next is pH is decreased and bicarbonate is also decreased. It is metabolic acidosis. It is metabolic acidosis. It is metabolic acidosis. Then if CO2 is normal, it is uncompensated. It is uncompensated. To correct metabolic acidosis, if CO2 is decreased, then it is partially compensated. It is partially compensated. So it is partially compensated. In case of partially compensated situations, look at the expected PCO2. Expected PC2. What is the formula? 1.5 multiply the normal value of bicarbonate. Sorry, 1.5 multiply the given value of bicarbonate. The given value of bicarbonate given value of bicarbonate plus 8 plus minus 2. It is a range. It is the range. So after compensation, if value if value within this range, then it is partially compensated. Then it is partially compensated. So after compensation, if value is within this range, then it is partially compensated. But if it is not this range, then it's mixed disease or simultaneous metabolic acidosis and respiratory acidosis. Simultaneous this metabolic acidosis and respiratory acidosis and respiratory acidosis. So in case of pH is decreased and bicarbonate is also decreased, means it is metabolic acidosis. To compensate, if CO2 is normal, so it is uncompensated. If CO2 is decreased, then it is partially compensated. Then it is partially compensated. What is expected pH CO2? Expected pH is 1.5 multiply the given value of bicarbonate plus 8 plus minus 2. This is the range. After compensation, if value lies within this range, then it is partially compensated. Otherwise, mixed disease or simultaneous metabolic acidosis and respiratory acidosis. Next point is next point is so here increase in 10 millimeter mercury carbon dioxide is equals to increase in 1 milligram per liter bicarbonate. So example 70 millimeter mercury carbon dioxide means 70 minus 40. 40 is the normal value of PCO2 So what is the raised value? Raised value is 30 millimeter mercury carbon dioxide. So what we expect the rise or raised value of bicarbonate? We expect 3 milligram per liter of bicarbonate is raised. So increase in 10 milligram mercury carbon dioxide causes increase of 1 milligram per liter bicarbonate raise. In renal tubular acidosis, bicarbonate decrease. To compensate, body produces more chloride. So what is the situation? Situation is hyperchloremic metabolic acidosis. Hyperchloremic metabolic acidosis. So in renal tubular acidosis, bicarbonate decreases. To compensate, body produces more chloride. So it is hyperchloremic metabolic acidosis. Next point is in nephrotic syndrome, albumin is decreased. So it is decrease of unmeasured anions. Unmeasured anions. Unmeasured anions. Because measured anions means chloride and bicarbonate. And rest of all is unmeasured anion. Rest of all is unmeasured anion. Next is during arterial blood gas analysis, we keep the wrist at extension. We keep the wrist at extension. Skin pierced at 45 degree. Syringe rinsed with heparin. Syringe rinsed with heparin. Next is Allen's test to assess ulnar artery patency, ulnar artery patency. So during arterial blood gas analysis, wrist at extension position, skin pierced at 45 degree, syringe rinsed with heparin, Allen's test assess ulnar artery patency. So what is the causes of metabolic alkalosis? What is the causes of metabolic alkalosis? First is vomiting. Next is hypokalemia. Massive blood transfusion. Next is loop diuretics or thiazide diuretics. And next is Conn syndrome. In Conn syndrome, increase aldosterone, so increase in sodium plus reabsorption. So body loses potassium and hydrogen ion. Next is renin secreting tumors, which causes increased aldosterone, So what is the cause of metabolic acidosis? In shock due to lactic acid and in necrotic enterocolitis. So in metabolic alkalosis and metabolic acidosis, the causes are important for MCQs. Next. Next is anion gap. Anion gap means the difference between sodium plus ion and chloride and bicarbonate ion. Normal value of anion gap is 10. Normal value of anion gap is 10. So delta ratio means increase in anion gap and decrease in bicarbonate. Decrease in bicarbonate. So normal anion gap is 10 and normal value of bicarbonate is 24. Is 24. Next, what is delta ratio? What is delta ratio? Delta ratio means increase in anion gap and decreases bicarbonate. If delta ratio lies between 1 and 2, so it is high anion gap metabolic acidosis. High anion gap metabolic acidosis. If it is lies less than 1, it is high anion metabolic acidosis and normal anion gap metabolic acidosis. If it is greater than 2, it is high anion gap metabolic acidosis and metabolic alkalosis. So it is greater than 2, it means high anion gap metabolic acidosis and metabolic alkalosis. Next is if respiratory rate increases, means it is hyperventilation. Due to hyperventilation, washout of CO2 occurred. So it is respiratory alkalosis. So here it is, and that's all.